Dr. Daniel Amen is a psychiatrist, brain imaging expert, best-selling author, and medical director of the Amen Clinics. He has pioneered the use of brain imaging in clinical psychiatric practice and is a noted expert in the field of the brain and behavior. Dr. Amen's breakthrough research and insights provide hope and more effective treatment for millions of people today.
There are many people who are anxious or depressed or obsessive, prone to anger, they have attentional problems, and they thought their problems were all in their head, purely psychological, if you will. In the research that I've done, what we found is that these and many other problems are brain-based problems, and that when we optimize the brain, their lives become better. We often say, you know, change your brain, change your life, and that's what we've seen.
We're going to go through a lot of information in the next hour and 15 minutes or so and talk about what is going to be one of the most common disorders that you see clinically. People who are traumatized need us. They need our help. I love this quote. It's one of my favorite all-time quotes from Confucius, at least it's attributed to him. To be wronged is nothing unless you continue to remember it. It's not being wronged that ruins people. It's not being wronged that really upsets your life or your character. It's what you do with being wronged. I mean, wouldn't you agree with me that we've all been wronged? A lot! Whether it's by teachers and how they grade papers, or by parents and how they treat you when they're irritable, or the legal system, or I mean, we could just go on and on. It's what you remember. And memories are so powerful. We'll talk a little bit about memories, and at the end of the lecture I'm going to talk about memory management and manipulation. It's a picture of my grandfather, who immediately, if I think about him, my mind goes back to when I'm 4 years old, and I'm standing on a step stool in front of the stove making candy. My grandfather was a candy maker. I mean, does it get any better than that? Right? Although I have cavities to prove it, my grandpa was a candy maker. And I smile. I feel joy inside of me when I go to that memory. But that memory shortly gets followed with the memory of his funeral. And if I talk about it for more than a minute, I'll start crying. I mean, I still get so emotional and start crying because of how much I miss him, how close that we were. And you wonder, well, why is that? It's because memories are attached to your emotional system. So when you lecture to a group, if you can make the lecture exciting, interesting, get them emotionally connected, they're much more likely to remember it. So, memories make us who we are. I did a show with Lisa Gibbons. You remember Lisa had a television show. And we did a show on memory and amnesia. And it was based on this book called Past Forgetting by Jill Robinson. And what we did is we had 3 couples where one of the partners in the couples had lost their memory. One, Jill Robinson, lost it because she had a seizure that wouldn't go away. She went into what doctors call status epilepticus, and she was swimming when that happened. So she went under the water, had a loss of oxygen, still her seizure didn't go away, and she was unconscious for 3 weeks. And when she woke up in the hospital, she saw a man in her room who was dressed really nice, and she thought he was the doctor. And he got very excited when she opened her eyes and said, oh, he came over and kissed her on her mouth. And she slugs him. Doctors aren't supposed to kiss their patients. It was her husband. She had lost 16 years of her life, the time she had met and married her husband. How sad is that? Or if they were having a bad marriage, how good is that? Right? I mean, if you could clean the slate, couldn't that be a good thing? Well, the other two couples on this show one of the partners had been in serious car accidents. And they lost the time they met and married their spouses. And isn't it the providence of God, isn't it interesting? I'd never seen that before clinically. In fact, when I first read the script, I went, they set this up. The next day, after I filmed the show in Hollywood, I went back to my Northern California clinic, and I was seeing a professor from the University of Washington who fell off the roof, lost 7 years of his life the time he had met and married his wife. And I was very helpful to them because I spent the whole day before thinking about what are the dynamics associated with that. So memories make us who we are. Lots of biology of memory. Well, there's something called the thalamus. Large structure deep in the brain that gets information into the brain. We call it the sensory gating part of the brain. They're the parietal and occipital and temporal lobes. They're what we call association areas. That's where memories are stored. So if you have a visual memory, likely it's stored in the association part of your occipital lobes, in the back part of your brain. If you have a sensory memory or a memory of movement, it's likely to be stored in your parietal lobes. If you have the memory of somebody's face, it's likely to be stored in your temporal lobes. And the temporal lobes on the inside also have the amygdala and the hippocampus, where emotions and the context of emotions seem to be stored. Your prefrontal cortex is heavily involved in memory because that's where focus is. And concentrate. You can't concentrate, you're not going to remember the things. Have you ever read a page in a book and got to the bottom and went, I don't think I read it. You had to go back and read it again. I mean, you have to be able to focus on what you're doing at the time to get accurate memories in. And there's this part of the brain they've just been talking about in the last 10 years or so called the posterior cingulate gyrus. We've talked a lot about the anterior cingulate gyrus and how it's involved in trauma and how people get worried and obsessive and can't shift. Well, the posterior cingulate gyrus helps information go from your temporal lobes to the association cortices. So when that's low in activity, you're going to have trouble storing memories. On the inside, toward the middle, doctors call that the medial aspects of your temporal lobes, is the amygdala. Greek for almond, because it's in about the shape of an almond. And it tags emotional meaning to situations. And many people think triggers get set off here. So if it's too low in activity, you don't react appropriately. If it's too high in activity, maybe because you've been traumatized, you react too quickly or inappropriately to situations. So the amygdala is very important. Neuroscientists are talking a lot about that area of the brain. Now the amygdala receives information from your thalamus, so directly from your senses. From your cortex, so you think about what you've experienced and then send information. Should I react? Should I not react? From the hippocampus, which evaluates sort of what's the context of this. And what's interesting is the connections from your thalamus to the amygdala are very fast. They're some of the fastest neurons in the brain. Now, why is that? So, for example, if you're walking in a woods and you see something that looks like a snake, well, immediately you'll react to it. And it's not until your prefrontal cortex kicks in and really focuses on it that it goes, oh, that's a stick. You don't have to worry about that. But have you ever reacted without thinking? And that's because there are actually many different inputs into your amygdala. And some of them, if they don't work right, you'll actually get erroneous or wrong information and you will react in a bad way. Or Well, I was just up in Northern California on a legal case. This guy who shot 2 people. I think I may have shared some of that with you. Well, he brings his gun and he's ready to threaten them, and he thinks that they're being nasty to him. But his temporal lobes don't work at all. So he is not able to read the situations. Frontal lobes don't work either. And so those 2 people may have died because his brain wasn't working properly and he couldn't evaluate the context or the reality of the situation. When the thalamus, sensory input, is too active, emotional memories can be formed on the basis of too much information that's not consciously processed through your cortex. And so the memory may actually be false. One book you ought to think about reading is called Too Scared to Cry by Lenore Tur. Her's a psychiatrist, child psychiatrist at the University of California, San Francisco. And she studied children in the Chowchilla kidnapping case, which was a famous case about, 20 years ago now, where this whole busload of kids was kidnapped. And they found that the children had dramatically different recollections of the same event. Why? It's because there was too much input coming in at once. Well, there's also the prefrontal cortex providing input to the amygdala. And when the prefrontal cortex is underactive, there's not enough thought that's going into processing new information. So in this case that I talked about, this man didn't really think about the total context of the situation and ends up reacting without thinking, which basically cost him his life. Because even though they did not convict him of first-degree murder, they convicted him of second-degree murder, and he's 65 years old. He'll never get out of jail. So if your prefrontal cortex isn't working right, again, you'll react to the wrong information. So when you're thinking about working with couples, and what couples remember and how they react to each other, the brain's very important to that. Because one, because of prior trauma, may be too reactive, and the other may react without thinking, or not be reactive enough. Posterior cingulate gyrus. Posterior just means toward the back of the cingulate gyrus helps get memories from the hippocampus into long-term storage. It's one of the first areas that's damaged in Alzheimer's disease. That's what the new research is talking about. So when it's hyperactive, we think it actually correlates with intelligence. In fact, there's techniques, one called neurofeedback, where you can put electrodes over the posterior cingulate gyrus, train it to work harder, and we think it actually improves people's ability to learn. When it's too low, memories can be lost, or fleeting, or distorted. So I want you to think of a memory system, a memory network in the brain. Now, there's a very important concept when it comes to trauma, and that's what we're going to spend most of the day-to-day talking about, is trauma, and that is kindling. And kindling occurs, it's a neurophysiology concept, where you take a neuron and you pass an electrical current through the neuron. And if you pass a low voltage of the electrical current, nothing happens. But as you raise the voltage high enough, pretty soon the neuron will fire off with the electrical current. And if you keep that current high enough for long enough, that nerve cell becomes what we call kindled. Now what that means is you can lower the voltage and the nerve cell keeps firing. Even low voltage will cause it to fire off. So, if you've been traumatized as a child, repeatedly, your nervous system becomes kindled. And so your mother yelled, screamed, was inappropriate, and it went on and on. Well, somebody later in your life just might give you the wrong look, and you react. You have a panic attack or you have a rage attack, not based on what happened, but because your nervous system has been reset to a new level. So we call that kindling. And it most likely happens with early prolonged trauma, or trauma that is very intense in activity. So what are some of the forms of emotional trauma that people go through? Well, some of them are pretty obvious. It can be abuse, physical abuse, sexual abuse, emotional abuse. I don't know if anybody listened to the news today, but in Long Beach, there was a 5-month-old baby brought to the hospital. And the doctor went, this baby's been abused. And they thought the baby was shaken. They had evidence of what we call shaken baby syndrome. And they think it happened at the daycare. And so now, on the news in Los Angeles, they're, making these announcements. Anybody who took their child to this daycare center, the police want to talk to you. Just that alone is going to cause trauma in the parent. Why? Because we play it out. We don't just see an event. Our brains, especially if we're anxious, will take this event and play it all the way out. Natural disasters. And here in California, we have lots of them. It's a great place to live, right? But we have earthquakes and floods and fires. Although I have to tell you, I grew up in Southern California. Living in Oklahoma, I was never more scared during a tornado warning. Because they tell you when they're coming, and then when I was in Tulsa, Oklahoma, we had several tornadoes go through. There were streets that were leveled. The only thing, you'd drive by the street and everything's just gone, except, periodically you'd see these brick chimneys. Hurricanes, man-made disasters. In fact, many people think it's harder to overcome or deal with a man-made disaster like war or fire or motor vehicle accident, bombs, terror attacks, robberies, rapes, muggings, attempted murder, and so on. Rescue workers have a very high incidence of post-traumatic stress disorder. They're often called first respondents, who's on the scene first: ambulance drivers, police officers, firefighters. If you listened to the news last week, there was a family in Fresno where 9 people were murdered. And they said on the news that police officers were crying when they came into the home and saw the children being murdered. And so working with fire departments, with police departments, is critical. Otherwise, these people are left with long-term damage from trying to be helpful to us in our society. Military personnel, immigrants fleeing violence. Again, very common here in Southern California. We have many people who fit that. How common is post-traumatic stress disorder? Really common. 3.6% of U.S. adults have PTSD during any given year. That's a lot of people. 30% of people who spend time in war zones will have symptoms of PTSD. 1 million veterans had PTSD from Vietnam. It's estimated that 8% of Gulf War veterans had full-blown PTSD. Can develop at any age. Symptoms usually begin within 3 months of the event. Occasionally not till later, but usually they begin right away. And it varies from a little bit, you can't sleep at night, you're having bad dreams, to you can't go to work. Or in one case, I know personally, they moved to Idaho because the woman had been assaulted in Los Angeles, and anytime she saw somebody of that particular race who assaulted her, she just had another panic attack. And so they moved to the whitest state in the Union, just so she could feel like she could go outside. Some recover within 6 months. Other people suffer with it their whole lives. Who's most likely to get it? people who were abused as children. And what you find when people have PTSD, and it's terrible and it's not getting better, is they really have layers of PTSD. That they don't have one trauma, they have 12 trauma. I did a show with CBS News in Los Angeles. Some of you may have seen it. It was just great. I'm very proud of it. And this man, Stephen Carey, worked at a bicycle shop in Santa Monica. And last July, he insisted, for some reason, he insisted to go to the Santa Monica Farmers Market. The same day, the old man drove his car into the midst of the Santa Monica Farmers Market, killing those 10 people, and Stephen was almost one of them. Stephen jumped out of the way, and he had medical training, he had people die in his arms there, and from that time he couldn't stop shaking. And he had nightmares, and he was avoiding people, and had full-blown PTSD. And the news anchor at CBS News takes her bike to his bike shop. And they were talking about it, and she noticed that he wasn't right. And she heard about our research with EMDR. And so she called up our clinic and said, would you be interested in helping us with this story? And I love media stuff because, one, it's fun, and I'm one of 7 children, and nobody paid attention to me growing up. But 2, you can educate like thousands of people. And so they brought Stephen to our clinic, and we scanned him, and he showed the PTSD pattern, which I'll show you. But in talking to him, you know, my first question was, any other traumas in your life? And he gave you that laugh that makes therapists very nervous. He's a Gulf War veteran. He was a tank commander. They estimated that 50% of the tanks they were going to lose on day 1 of the Gulf War. He'd killed people. He saw some of his buddies being killed. He also grew up in a very severely abusive alcoholic home. 7 years old, he comes home from the movies with his mother, and their house is burned down. The alcoholic dad burned down the house. 5 years old, even going beyond that, he's standing on a curb in a white t-shirt, eating a vanilla ice cream cone. And right in front of him, there's a motorcycle accident. And he just knows. He says, I don't know how I knew, but I just knew the guy was dead. But I looked down at myself, and there's blood all over his t-shirt, the ice cream cone. He drops it. He runs home. And what does he do? Not tell his mom and dad. He throws his shirt away because he thinks he's going to be in trouble because the shirt is damaged. So as you look at Stephen's PTSD, there are multiple layers to it. And with the treatment, he's so much better. I mean, it's so exciting. So, many people have PTSD, have layers of it. And he used to believe that people who were emotionally numb after the trauma, that was healthy. They showed a healthy response. What now people believe is the emotional distancing actually makes them more prone to PTSD. And we'll talk about the neurochemistry of that in just a minute. The symptoms of PTSD, it's classified as an anxiety disorder. It occurs after some form of terrifying ordeal. They repeatedly re-experience the trauma with flashbacks, with memories, nightmares, frightening thoughts, especially when they're exposed to anything that reminds them of the trauma. And because of how the brain works through association. It can be anything that happened around the time of the trauma. So if you go to a park and you're raped, the next time you go to a park, it might trigger a panic attack, and you might not have any clue why, because you don't associate this happened in a park. Or if a certain smell was there when you were being abused, that smell can trigger off a panic attack, and you might not have any clue why. And that's where hypnoanalysis that we'll talk about can be very helpful to start connecting the bridges between events. Anniversaries of the event can trigger symptoms. People become emotionally numb frequently. They have sleep disturbances. They may get depressed. They're frequently anxious, irritable, temperamental, often have intense feelings of guilt and they avoid any reminders. So they may not even go to work if there was a work trauma. I mean, that may be the end of their work life unless they get help. It's diagnosed when symptoms last more than a month. What goes with PTSD? Lots of things. Depression, substance abuse. Lots of interesting research on can people who abuse substances get better if you don't treat the underlying PTSD that many of them have. So you have to think of co-occurring conditions. Other anxiety disorders like panic disorders, and they have emotional overflow that affects them physically. Headaches, tummy aches, immune system problems, dizziness, chest pain, discomfort in many different parts of their body. The research in PTSD, fear is an emotion that deals with danger. It's actually an emotion that's protective, and it causes an automatic, rapid, protective response in many systems of the body. Right? When you get afraid, your hands get cold. Why? Because blood is shunted to the bigger muscles, like in your shoulders and your arms, so you can fight, or in your legs, so you can run and deal effectively with the fear. The fear response is coordinated with the amygdala, and many anxiety disorders are also associated with the amygdala. So it's a normal response that then becomes abnormal. Hippocampus, as we talked about, it's the part of the brain critical to memory and emotion. It appears smaller in PTSD. Why? Because what we know is chronic exposure to stress. People have PTSD, have stress that sticks, if you will. You can't get away from the stress. Chronic exposure to stress hormones kill cells in the hippocampus. And a lot of the research says the hippocampus is smaller in people who have PTSD. But with the whole notion of